Hays County. Thank you for tuning in to our Facebook Live event. We are making this event specifically for you to get yourselves up to speed on everything going on COVID that pertains to us. And when things aren't in our power to influence, we want you to know that as well. So please, at the very beginning here, I'm telling you now, any questions you may have, write them in as comments, and we will get to as many of them as we can, and we will have them read out here, and we will provide the answer live. So the first thing I want to say is, hello, my name is Ruben Becerra, and I am your county judge, also serving as the Emergency Management Director and the Director of Homeland Security. With me today, we will have Alex Villalobos, our Emergency Management Coordinator and County Chief of Staff, and we will have Tammy Crumley. She's also in charge of our health department, and she is countywide operations. She helps on many fronts, but specifically our health department is why she's here. And we also have Mike Jones, who is our Emergency Services Director. I know all these titles can get confusing. Don't have to memorize them. There won't be a quiz, but just know this. We are the tip of the spear charged with COVID response here in Hays County. And just know that if I was to bring everyone that is helping on COVID response in Hays County, we would fill this room, and you would never know what everyone's doing, yet everyone is continuing to work hard on all these things, COVID. And this is one thing that we've never shut down is our county government. We keep working, we stay on, and we are here for you. And that's the whole purpose and spirit of this effort, is to get to you in every way we can. We're putting out press releases. I regularly make posts on Facebook. I'm always trying to share information. This is not intended to be a debate. We will not debate whether masks work or not. So if you have a question about whether they work or not, save it. We won't address it. We have a variant of the virus that has been detected in the United States in several places. The nearest one so far is Harris County. And there's no question that this thing will spiral into other consequential events. Because if a virus is more contagious, then more people will get it, even if it's not more deadly. More people will get the virus. And when more people get the virus, then you have a certain percentage that's going to end up hospitalized. And when that certain percentage is hospitalized, you're going to have a certain mortality rate. And so I take none of that for granted. Your safety is my concern. And so it's just important for me to get some ground rules down. If you think we're going to address any controversial perspectives, whether it's the flu or masks don't work or any of those kind of things, don't waste your time. Log off or swipe up. We're clearly not going to be the audience for you. So what I will do is also say thank you to the state. They have helped us out. So far, we have received, just recently, 300 vaccines. I don't know if that's symbolic or not, because we have approximately 300,000 people in Hays County. So I'm an eternal optimist. I'm a grateful soul, and I will not be rude or negative. I'm hoping for more. I'm hoping that we'll shed some light and learn more as we go. But I will tell you this, I am going to continue to fight for the residents of Hays County in every way I can. And some may not like it, but the most important thing is I'm here for you. I'm here to serve you. And if you have an interest in guiding us, just know that our hope is to be most useful. With that, I'm going to turn it over now to Alex Villalobos.
Thank you, Judge. Thank you very much for the introduction. I think you'll see a theme of work ethic here, that we're all here to get a job done. We're all here to do the best that we can to ensure that we're serving our Hays County in the most efficient way with the resources that we have available to us. We are obligated to do that. Number one, I just wanted to talk about COVID testing, COVID vaccine, the alternate care site, our isolation facility, with one of our partners and the infusion service that is ramping up as we speak. Number one, for COVID testing, I think within our COVID testing plan, we were the model for the state for drive up and walk up distribution of tests. We have done a good job of getting those tests out, provided the resources that we need to get those things out to the population in Hays County, and also making sure that we are communicating those particular resources in a way to ensure that we are driving forward in multiple languages and that we're addressing our vulnerable population with the resources that we have. So testing across the board, I'm sure that some of you have seen the curative vans in the area. We have done mass distribution testing at our school districts, and we continue to do that throughout the county. And there is a registration process through curative.com. If you need a test, please sign up, get an appointment, and go get tested. Those are available readily for you. COVID vaccine. I think we have three different questions that we need to answer here for the county. Where are we now? Where are we going? And what do we need to ensure that we can get the job done? A couple of those questions will be addressed through some of the other team members, vis-a-vis Tammy Crumley, the Director of Public Health, and Mike Jones, the Director of Emergency Services. Our alternative care site. As the census numbers continue to rise in some of the hospitals and we need more space to address our community's needs, an alternative care site was established and has recently been taken and managed by our CATRAC, which is our Capital Area Trauma Regional Advisory Council, along with the partnership and collaboration of TDEM, along with the 29 county region. All of the emergency management coordinators and staff within those counties have been on calls, learning and understanding how we're going to operate this alternative care site to be able to use it efficiently and effectively for our community. There's tons of communication with the hospitals throughout the region as well, because they will be a partner on making sure that we understand how to refer these patients to those areas should we need to use that service. We have an isolation facility that's been stood up by Austin Travis County. Hays County, along with the entire COG and the region, has been steadily collaborating with Austin Travis County for use of the isolation facility. We have sent some of our committee members to the isolation facility with great communication from the staff at Austin Travis County. We've been able to serve our community that does not have another place to go should they be infected with the virus, to ensure that they have the time and the resources to recover and to get back to healthy. We also are working with the infusion service. That is also a collaboration between CATRAC, again, that's the Capital Area Trauma Regional Advisory Council, and TDEM, specifically EMTF, which is our Emergency Management Task Force, are standing up the infusion center that's currently in Montopolis in Austin, which is on the southeast side of Austin. They are currently increasing capacity for that particular facility. They are standing up a call service for it to ensure that we have the ability to make appointments and referrals to that location. They are still in process, but that is coming. And they are reaching out to the various partners and the medical provider partners to ensure that we have that as an option for some of the COVID positive patients that require that type of service. It's a very narrow criteria for that type of service. There is information out there with regards to the infusion service in the area and on a lot of different social media feeds, but it fits a very narrow criteria. We as a county will be providing that criteria as soon as we solidify how we make referrals and how to utilize the service on behalf of Hays County residents. We're doing everything that we can in collaboration with both government agencies, private partnerships, to ensure that we are doing everything that we can with the resources that we have in our hands to serve all of you as the community. We are here for you. You are our number one obligation, and we'll continue to do that based on the resources that we provide. Some of these things come in with certain criteria that we must meet that has been established by the state. vis-a-vis through the governor's office, and also to the Department of State Health Services. Some of the specifics that come in through will be answered here shortly through Mike Jones. And as we segue into that, I'd like to introduce Mike Jones, the Director of Emergency Services here for Hays County, to address some of the questions. Oh, I'm sorry. It'll be Tammy Crumley, the Director of our local public health department, and she will address some of the specific questions and then anything that she has an update for you as well. Thank you very much.
Tammy Crumley, Director of Countywide Operations and Local Health Department. Sorry, can you be a little bit louder? We are working vigilantly on getting out our COVID vaccine plan. We are waiting for the state to provide us those vaccines. We have received our approval from the state weeks ago. We still have not received more than our 300 allocation. We are prepared to start administering those to our 1B population. We are anxiously awaiting for more. We have been waiting for weeks to provide those to the public. Right now we're having to route them elsewhere. Our pharmacies are maxed out, vaccinating the 1A population. It is very frustrating for us as a local health department not to be able to provide that to the public, but that is unfortunately where we're at right now. And we do appreciate your patience and understanding with us. We are very frustrated. We have been frustrated, and this is unfortunately where we're at as a community. Excuse me. It's been a long 10 months, and we have done the best that we can, and we hope that you understand that. Austin Public Health has started with their hub this week. They are vaccinating. They received their 12,000 allocation. They, as of yesterday, have vaccinated close to 4,000 citizens, and they have that information on the website. I believe it's also on our website. I think we have questions coming in, and we'll answer those here in a bit. So I'm going to hand it over to Mike Jones, who is our Director of Emergency Services, and then we'll be back with some additional questions from the public. Thank you.
Good afternoon, Hays County. Thank you for joining us on Facebook. We're hoping this is answering some of your questions that have been sitting out there. I think Tammy made a very good point when she said patience, and that's our virtue for right now. For, as you know, we cannot employ our plans that we put together quite well for vaccine distribution and dispensing until, of course, we have the vaccine. But rest assured, we do have a very good plan that we work with our partners here in San Marcos in our Hays County emergency service districts, and also to include our private partners such as Communicare, Premier ER, San Marcos Family Medicine, and to include, of course, the university. And we've been in contact with them and discussing plans and options for distribution and dispensing there too. So rest assured, we do have a very good plan once we do have the vaccine in hand. And like anything, supply and demand, we have a lot of demand out there, which is good. We're glad to see that out of y'all. And once we have the supply, we'll hopefully be satisfying those demand appetites. I do have a few things I want to share with you as well. Once we do get the vaccine in place, we will be opening dispensing sites, and we'll be putting that on social media. It won't be a secret. You'll know where to go to. You still, at this time, have the options to go to your private partners, such as your provider, your doctor, the HEBs, the Brookshire Brothers, who are very good in helping get things rolling here in Hays County, considering the small amount of vaccines we have available. Also, there's the curative vans that are out there doing the testing right now. I've been telling you to speak up. The curative vans that are out there that are actually they're doing our testing will also be helping us with the vaccine distribution as well. So expect to see those mobile vans coming into your neighborhood in some areas. Other areas, maybe some of your favorite shopping. As you know, right now, if you want to go shop and get a test at the outlet mall, you can do that. the biggest part behind this entire message we're trying to give you all today is patience. We believe that Hayes leads the way, and we can lead real well once we have a vaccine in place. And it's just a matter of time. When I say time, I'm talking about the short stick. I'm not talking about the long stick. By June, we know the entire nation will have the vaccine they wanted. But as far as Hayes is concerned, we plan to have that in much more short order than what you've been expected. I'll be ready to your post on nextdoor.com. We appreciate your interest. But once again, instead of doing any finger pointing or name calling, just remember we're here working for you too. And we're going to get that vaccine out to you as soon as possible. I believe we do have some questions online. I know the judge wants to probably address some of those, so I'd like to bring the judge back up here so he can address some of those questions. Thank you for your time, and thank you for being here with us.
So thank you so much for tuning in. We are very grateful, and our job is to provide you information, and ideally, the road mapping will help provide some level of comfort, however we could provide it. One of the questions I've heard and seen, I got this in court, for example, was I going to mandate vaccinations? Absolutely not. No how, no way. As Mike has just articulated so perfectly, only those that want a vaccine will get one. Not me at a county level, not the governor at a state level, and not the president at a national level will mandate vaccinations for anyone. That's not who we are. That's not what we do. And so now I will ask Anita to approach where we could hear these questions, and we will stand by to see who will step up to answer it best, most completely.
Okay, the first question is, what are you doing to work with local providers that do have the vaccines to be reached easier?
Who would like to take that one? Tammy? Best fit? Sorry.
The providers that have already received the vaccine have allocated those to their patients and are already working on their second dose. And so those, as we understand it, are not available. I think HB is advertising that they are out of the vaccine and not taking any additional appointments. Although they are showing that they have numbers still left online, they do not. So when they have it allocated to them, there's a number that's entered and they have to report that daily to the state. Those numbers don't start going down until all of the doses have been administered. They're not going down because they haven't administered them yet because they still have appointments waiting. So those vaccines are not available to the public. You have to call the providers, but our understanding is most of them have already been spoken for.
Next question.
Okay,
We will be working with them in the future though when the allocations start coming and the vaccine is more readily available.
thank you, Tammy. The next question is, will Hayes County be setting up a vaccine sign-up portal?
Comfort, however we could provide it. One of the questions I've heard and seen,
The curative vans that are out there that are actually your areas, other areas maybe some of your favorite shopping. As you know, right now, if you want to go shop and get a test, it'd be all real well once we had a vaccine in place. And it's just a matter of time. When I say time, I'm talking about the short stick. I'm not talking about the long stick. By June, we know the entire nation will have the vaccine they wanted. But as far as Hayes is concerned, we plan to have that in much more short order than what you've been expected. I'll be ready to your post on nextdoor.com. We appreciate your interest. But once again, instead of doing any finger pointing or name calling, just remember we're here working for you too. And we're going to get that vaccine out to you as soon as possible. I believe we do have some questions online. I know the judge wants to probably address some of those, so I'd like to bring the judge back up here so he can address some of those questions. Thank you for your time, and thank you for being here with us.
So thank you so much for tuning in. We are very grateful, and our job is to provide you information, and ideally, the road mapping will help provide some level of comfort, however we could provide it. One of the questions I've heard and seen, I got this in court, for example, was I going to mandate vaccinations? Absolutely not. No how, no way. As Mike has just articulated so perfectly, only those that want a vaccine will get one. Not me at a county level, not the governor at a state level, and not the president at a national level will mandate vaccinations for anyone. That's not who we are, that's not what we do. And so now I will ask Anita to approach where we could hear these questions, and we will stand by to see who will step up to answer it best, most completely.
Okay, the first question is, what are you doing to work with local providers that do have the vaccines to be reached easier?
Who would like to take that one? Tammy? Does fit? Sorry.
The providers that have already received the vaccine have allocated those to their patients and are already working on their second dose. So those, as we understand it, are not available. I think HP is advertising that they are out of the vaccine and not taking any additional appointments. Although they are showing that they have numbers still left online, they do not. So when they have it allocated to them, there's a number that's entered and they have to report that daily to the state. Those numbers don't start going down until all of the doses have been administered. They're not going down because they haven't administered them yet because they still have appointments waiting. So those vaccines are not available to the public. You have to call the providers, but our understanding is most of them have already been spoken for.
Next question.
Okay,
We will be working with them in the future though, when the allocations start coming and the vaccine is more readily available.
thank you, Tammy. The next question is, will Hays County be setting up a vaccine sign-up portal?
Yes, the Hays County will be setting up a vaccine portal. You'll get to go to haysinform.com and go through that effort so you can sign up and do the QR registration code and then pick the location when you get your vaccine in, when it's open to the general public.
Thank you. The next question is, who will be priority recipients of the vaccine when received by the county?
The county will follow the state's vaccination plan, so we will be instructed by the state on which citizens are to receive the vaccine, and we will follow that plan.
Another question is contact tracing being done?
Tammy?
Yes, the health department is continuing to do contact tracing with the number of positive cases that we are getting in daily. We are, the staff there is working diligently to contact everyone. I will say that with the wide community spread, it is extremely difficult, I think, for anyone to know where they came in contact with anyone. So if you go anywhere on a regular basis and are out and about in the public, you have probably come into contact with someone. So contact tracing is, while it's important, it's also important to understand that you are running the risk anytime you go out in the public. So having contact tracing be the most important thing right now is not necessarily the case, but we are still continuing to contact trace.
Okay, where can we register for the vaccine?
There is currently not an online registration, as Mike just said. Once we have our allocation and our QR code registration system, that will go live and there will be public information available for that on our website and every social media outlet.
Okay, there's another,
What I'd like to expand on just
Sure.
for a second.
mm-hmm,
What I'd like to expand on is Austin Public Health is working as a hub at this moment for the residents of Hays County. And so you can, although it's going to be wading through quite a bit, you can go to their website to register. And their goal at this level, in this tier, is to vaccinate the uninsured or the underinsured and the vulnerable population. So if you fit those criteria, that'll be perfect. And you can register now, but you'll have to go to Austin for the hub perspective of the vaccinations. And you have the website there?
I do, and there's also a phone number to call if
Perfect.
you don't have that. So it's the austintexas.gov /COVID-19 hyphen vaccines, and there also is a phone number. We've had some concern about people not having access to the computer or internet. The phone number is 512-972-5560. Again, 512-972-5560 for the Austin Public Health Hub that's providing COVID-19 vaccines.
Okay, there are a lot of questions about the 1B group. Will there be any priority given within the 1B group? And how, the other question was, how can the 1Bs get on the list for vaccines?
If you're in the 1B group, that is, anybody in that group is the same. There's no priority given to anyone in particular in that group. And I'm sorry, Anita, can you repeat the second part of that?
Sure. Can 1B get on the list for vaccines?
There is not necessarily a list. As soon as we have enough of the vaccine that will become available, they will be able to register for that as well.
Okay. Will demographic information be provided on who has received the vaccine?
We plan on providing GIS information on which areas of the county have been vaccinated. I don't know at the state level what they will be able to provide.
Is the county's plan for distribution available for review?
We have not released a written vaccination plan.
Okay. I'm scrolling. There are a lot of questions.
While you're- Anita, while you're scrolling,
Sure.
there seems to be some great interest out there, which is real positive. And I've had several folks contact me in my office as far as what they can do to assist us in this endeavor. So if you would like to help and volunteer in helping us as we execute this plan out there are many areas where we could use those volunteers. Currently, we'll be using our community emergency response team members, commonly known as CERT. You've seen them out there in their green shirts and yellow letters. In addition to that, we've reached out and asked Texar to come out to assist with us, and a few other organizations to help us there too. So if you would like to help us in this endeavor, you'll go to HaysCountyCert.com and then click on that center yellow tab that says Join Hays County CERT. As you fill that document out, it's going to ask for a nickname. In the nickname location, write the word COVID. That way we know you want to volunteer for this expedition as we do the distribution and dispensing throughout the county. Love to have you out there, come out and help our community partners and community members, and I look forward to seeing you in the future in that respect. Do you have any other questions there, Anita?
I think anything else we can probably address online.
Sounds
You know,
good. Then
yeah.
I might turn this back over to the judge, sir.
Okay.
I just want to reiterate on the piece with communication with total inventory of vaccinations and dosages. We'll also just reiterate that there's a large amount of paperwork that goes into play to ensure that we are utilizing the distribution of vaccine within the appropriate plan as prescribed by the state. So there is constant contact, constant calls, constant data that's shifted back and forth to the state to ensure that we are number one, following the plan, and number two, that we're distributing those dosages in a timely and efficient manner, because that's what allows us to call more inventory to come towards us when it's necessary to start assessing and projecting the need for a prospective area that's distributing vaccine for COVID. Just want to let you guys know a lot of that information will probably be shared on the state sites as well, which would probably include the areas where we're distributing, the people that are getting it. Again, we just went through the phase 1A, we are going into phase 1B, and if you were to see that through the DSHS site and look at the criteria for it, read the entire page. It's about a sheet and a half of information. It's very detailed on who fits the criteria for phase 1B. We are following the plan and ensuring that we get those people done as the plan has been laid out. Thank you very much for your patience again. We want to ensure that we are contacting and collaborating with people on a regular basis. We are working with our regional and statewide resources and federal resources to ensure that they understand that we have a plan, we are ready to distribute, we are ready to serve our people, and we are waiting to receive that inventory so we can do what we've been preparing to do and what we've been trained to do, and to fulfill our obligation to you as the citizens. Thank you very much. Judge?
Thank you. Okay, so I want to tell you this again is exclusively for your benefit. We are here to serve you. The four of us that have been on this walking panel have nothing but public service in our hearts. Our goal and our aim is purely to be useful. How can we best serve you? And so please continue to ask your questions. We will answer all of them, although of course not at this moment, but we will answer all of your questions. And if there's a repeated question, we'll copy paste a little to keep things moving. And as information continues to unfold on the vaccinations, because it is very fluid at every level of government, we will come back to you through this avenue and hope that through your network of friends and family, you could share the information as it becomes available and we share it with you. Thank you for tuning in. We are very grateful. Continue to be mindful and kind to one another because no one knows what the other is going through. You can't see mental stress. You can't see the mental health conditions of anyone around you. You can only hope that your golden rule thought process will step in this very sensitive time for us as a community. Please remember, find the things that unite us because together we can do a whole lot more. Thank you, Hays County.